Start with a good skincare routine which involves a sunblock definitely in the morning and a vitamin C in the morning again. In 50s, I would continue doing therapy and I would add a little bit of MNRF, which is the micro needling Morpheus treatment. So maybe 2 times in a week, start using exfoliants which can be AHA or BHAs depending on your skin type.
Right.
And alternate them with a very small percentage of retinoid, pea-size amount. And if your skin is really dry, then you can use a sandwich method, which is moisturizer, retinoid and then the moisturizer on top.
Right.
So if you're going into a salon, check what they are using, ask the product, see the bottle for yourself and start reading the labels. You get sold off when you're told that it's a smoothing treatment and the name is keratin.
You're watching the Clique on Hello. I'm Chaiti Narula. Dr. Geetika, Mittal, it's been a while, but I'm so glad we're catching up because we're talking about summer and monsoon and skincare is so essential. I want to first start off by asking you a few questions, right? There is a lot of confusion in terms of what is retinol, what is retinoid, what is tretinoin, and something else also. Like all these words keep floating around and we never know what's the difference between any of these and who should use what.
These are all vitamin A derivatives and different percentages and different absorption levels is what differentiates them. So whenever you're picking anything which is retinol, retinoid, retinol palmitate or tretinoin, for that reason you need to know what percentage and what skin type you have, how you're going to use this, because there is something called as retinol rule book that you need to follow, because retinol purging is for real and if you don't follow it correctly then definitely you're in for some trouble.
So if you consider BTS iconic, that means you're a Gen Z, what should you use?
Start with a good skincare routine which involves a sunblock definitely in the morning and a vitamin C in the morning again. At night you can start using exfoliants because Gen Z is also prone to a lot of pigmentation and acne issues. So maybe 2 times in a week start using exfoliants which can be AHA or BHAs depending on your skin type, and alternate them with a very small percentage of retinoid. Now that can be retinoid palmitate because that is less irritant on your skin.
But retinoid palmitate?
Yes, but only use it 2 times in a week, pea-size amount, and if your skin is really dry then you can use a sandwich method, which is moisturizer, retinoid and then the moisturizer on top.
Right, and the moisturizer can be replaced with hyaluronic acid too, right?
But that will increase the absorption of retinol.
Oh, is it?
So you don't put hyaluronic acid before any actives which are like exfoliants or retinoids because that will increase the absorption and make it more concentrated. Rather just use a moisturizer which is a barrier repairing moisturizer.
If you think Alia Bhatt is iconic, which is I think my age group, what should be your skincare?
So for that generation definitely I would suggest again following the simple rule of skin cycling, but here you can increase the percentage. You can start with a 0.05% if you have not been using it already and then start seeing and reading your skin that how is it reacting to.
So it's going to be retinol, right?
Yes.
Or
then
retinoid?
it will be now retinol. 0.05% you start with and then you can increase the percentage maybe after a couple of months and use it maybe 3 times in a week. Idea of skin cycling here would be 2 times in a week you use an exfoliant, 3 times in a week you use a retinol, and 1 day you can just give your skin a break, which is called skin fasting. Just use moisturizer and let the skin repair.
That was my consultation right there. But if you think Deepika Padukone is iconic, which is when you are late 30s or early 40s.
So that depends on the skin type now. We can even continue using the same 3 days rule or you can make it even more stronger. If your skin has certain issues like pores and acne, this is the time you can start introducing tret in your skincare routine.
That is tretinoid.
Yes, but you need to meet your doctor to understand that how you need to use it. So it won't be right for me to say that, oh, start using it because it's
very harsh, right?
Yes.
If you don't do it correctly.
Yes. So maybe use it just once or twice in a week. Again, a pea-size amount, and remember, this is the time you need to remember your face doesn't end on your chin. It extends beyond because your neck will start showing the signs of aging very quickly.
Now, myths versus facts, right? So let's begin with the first one, which is the most scary one. You walk into a salon and you're all getting keratin treatments done. And I've had it till here telling people that keratin is not good for you, but you have to hear it from the doctor.
Very nice of you to bring this up because it's very important to get educated. You get sold off when you're told that it's a smoothing treatment and the name is keratin. Well, it's not going to infuse any keratin into your hair. It is actually going to break those bonds. Because only when those keratin bonds are broken, your hair are sleeker and shinier.
And what about Botox then?
So they are all the synonyms of the same treatment.
So keratin treatment, Botox treatment, everything is the same?
Yes, there are more companies now which are using non-formaldehyde treatments, and they call it hair Botox as well. So if you're going into a salon, check what they are using, ask the product, see the bottle for yourself, and start reading the labels.
Makeup is bad for the skin. Is that a myth or is it true?
I don't think so makeup is bad for your skin unless it's not taken off correctly or not put in correctly.
Radio frequency is not good for Indian skin type, and hence you should not get MNRF done if you're in India.
MNRF is microneedling with radio frequency. I think why people are hesitant, because these treatments have a little downtime. And when you have downtime, you need to know the post care of the treatment.
So that's what, right? You have to put a lot of sunblock and make sure you're protected.
Yes,
just
you
like
have
you
to
do
put
with retinol.
sunblock, no makeup. If you're stepping out, make sure you carry a scarf. And of course, don't over-treat your skin. Let your skin barrier get repaired.
So now we've obviously spoke about different age groups and which retinol, retinoid that they're supposed to use, but we haven't spoken about the treatments that they should do also. Let's start with Gen Z. What are the treatments that you recommend in cosmetology?
So Gen Z would just need a deep cleansing treatment to remove all the sebum, blackheads, whiteheads from the
So
pores.
cleanups.
I would just love HydraFacial, which is
facial.
a perfect deep cleanup for the skin.
HydraFacial for Gen Zs.
Yes.
Millennials.
I would like to use some little bit of IPL laser over there to improve the blood circulation.
Yeah.
My favorite would be the Photo Glow Infusion. Gives you the glow, removes the tan, removes the blackheads, whiteheads, and improves the collagen also.
If you're in your 40s.
I would love doing therapy once in a year. You know that.
Yes.
So that's
therapy is magic,
yes,
magic.
That's something that even I get done. So once in a year for the collagen building up.
And in 50s.
In 50s, I would continue doing therapy, and I would add a little bit of MNRF, which is the micro-needling Morpheus treatment, to infuse the PRPs, the exosomes, and just nourish your skin a little more.
60s.
60s. Of course, therapy and MNRF continues, but I would also take out some time to nourish my skin and just relax and nourish with the help of these medifacials like Biologique Research or Warmont to just nourish and relax.
At that point of time, your neck becomes also very important. Your neck skin.
Yes, and
It
we
takes
take care of that with
everything.
therapy. Yes.
Okay, 70s.
If you have been doing all of it, then you stick to it and you're great. But if you haven't, and now is the time you realize you need to do something, then is the time we need to take a little leap and do a slight bit more. Understand what is that you need. There comes thread lips, there comes injectables, but we all understand that these treatments are curated and tailored as per your need.
Right.
You know, not for everyone.
80s.
Enjoy life. Keep that sunblock on.
Keep that sunblock on. 90s, keep the sunblock on.
Yes.
Have fun. We don't want to say anything beyond that.
Absolutely, absolutely. Good life.
Well, thank you, Dr.
Thank
Geetika, for
you.
joining us as always. I wish you all the very best, and thanks for
you.
taking the time out.
Thank you. Thanks for having me.